Hey everybody, Joe here from Engaged Personal Training in Collegeville. I'm having the opportunity to sit down with Dr. Jeff Snyder of Snyder Family Chiropractic. They're located in Phoenixville at 1003 Egypt Road in Building A, 19460. So we're going to have the opportunity to get a little insight on the chiropractic care that Dr. Jeff offers, who he serves in that, and what population he works with, and also get just a nice brief understanding of what chiropractic care is and why it's important. So with that, tell me a little bit about your background, your credentials, and how long you've been in the business.
Sure, Joe. So I've been in practice for 25 years at this point, and my credentials are similar to yours. So I have the exercise and sports science background, graduated from Penn State in cardiac rehab, but then transitioned into going to chiropractic school. And I've been in practice now for over 25 years doing this.
Yeah. A lot of people have heard of chiropractic care and possibly have even experienced it, but still don't understand the benefits and why it's important. So can you give me a nice little brief rundown on how you would describe what chiropractic care is and why it's important?
Sure. Essentially what chiropractors are doing we are working on not the spine itself, but more so the nerves that exit from the spine. The nerves are connected into the brain. So the brain connection into the body, and all these nerves go to the various parts of your body. So what my goal is, and I should say two-part, people will come in here primarily because they're having a condition that they were hoping to have resolved in some way that they heard chiropractic here could help with. But my goal is to find where there's dysfunction in the spine. And the reason why is because when there's pressure upon nerves, that pressure can distort the way that nerve functions and can ultimately cause a problem with regard to the problem at hand, such as neck pain and back pain. Some people have asthma, and I'm not treating any of these conditions specifically. I'm not treating asthma, I'm not treating cancer, I'm not treating any of these things, but the body works better when the nervous system is functioning better. That includes athletes.
Yeah. So you're saying with this care, it might help increase people's capabilities of doing everyday things outside of here.
And there's some research to show that actually at this point as well. And a lot of research in the athletic world.
So that would be good for my clients too as well, because if they're experiencing any limitations with the training and they came to work with you and we were able to open up or free some movement up a little bit and they were moving a little bit more comfortably, they can come in and possibly have some more successful sessions.
Pain-free or reduced pain for that matter. Better for the nervous system in the fact that their body's position sensing, what we call proprioceptive, in their legs and everything else combined, their bodies will work smoother, and ultimately they'll have a better workout for sure.
Right. I think a big concern for people when they think about this and they think about the spine is chiropractic care safe? And then how would you go about explaining to someone that this is something that is safe and it's something that you can do recurringly?
The statistics are pretty clear about this. Chiropractors do not hurt people. And the way we know that that's the case is because if you look at malpractice rates for surgeons are astronomical. They're very expensive because of the fact that it's a very risky procedure that they're going to do. Chiropractic malpractice rates somewhere around $1,200 to $1,500 per year. Which is significantly less than you would find with any general practitioner or private, a medical doctor who is in practice, or worse, obviously in the malpractice range is the physician. So if we were hurting people, then the actuaries that look at malpractice rates would say these chiropractors, they hurt people a lot. We're going to cause those rates to be real high. Now I can also tell you that from my personal experience, over 25 years, I have not had one single case at all. So I do my best to really, honor the body so we don't hurt them.
Numbers don't lie, right? So you have all that there is backed by your extensive experience over 2+ decades, and then obviously everything else you mentioned about the malpractice. Now, is your treatment just strictly back and neck related, or is there anything else expansive beyond that?
Actually, it's a good question. You see, most people do come in here because they feel that they have a neck problem, a back problem, and those are fairly typical. But then people will be here and they'll tell us during the examination that they're also having a shoulder issue or a wrist issue. We'll be able to determine those issues by basically looking at orthopedic tests and looking at the range of motion and determining whether or not it's a soft tissue issue or it's a joint or nerve type of an issue. And there are ways of addressing those types of concerns either through a manipulative type of a technique or procedure, or doing some type of soft tissue work to help to alleviate issues around that soft tissue, around that joint region.
You could be having some discomfort or pain somewhere, but it could be coming from another source.
It's very possible.
Yeah.
For instance, as you just alluding to, sometimes people will have a problem or pain in their hand or in their wrist for that matter, and they think that they're having a problem like carpal tunnel. And in fact, in actuality, they're having a problem with their cervical spine. It's the nerves from the neck, they go down into the arm.
Yeah.
Now they could be having both. So in a scenario of what's called a double crush syndrome, they could have the problem in here and have the problem here. And there's ways of testing for that. And if they're having an actual carpal tunnel problem that we cannot correct, or for that matter, any problem that we cannot correct, on the rare occasions that happens, I have a number of different physicians in the region here that I can refer to in the event that they actually need some type of care that's outside of my scope.
Yeah, the buck doesn't just stop with you.
No.
This is a great place, either a starting point or an addition to what people are already doing.
And then sometimes that referral has to go to somebody like yourself,
Yeah.
because they are needing some type of real good guidance on being able to get that strength back in a region of their body to help to support that body.
Yeah. What is your initial process for like assessments, and what would a first day for somebody coming in look like?
They'll provide us information about their health history. I'm going to do an evaluation with them. That examination is going to be about 40 or so minutes, because we really take a lot of time to make sure that we uncover every piece of the puzzle. Sometimes more than we expected at first, but it does give us information so we can move forward and either order diagnostic tests or images, or we can move forward in doing some type of treatment. So we would do the orthopedic tests, we would do neurologic testing. I would have them on the table doing chiropractic specific testing, palpating their spine, and checking other parameters that help us to know where the problem is, helps me to know if I can help them, and also helps me to know if I cannot help them.
Yeah.
Because if I can't help them, I'm going to refer them to the right place, and that does happen on occasion.
Yeah.
But if we can help them, I'll be able to let them know at the end of that evaluation what we can do. And for that matter, how long it might take.
Speak a little bit about this thought of chiropractic care being addictive or something that you have to do forever.
I've seen this so many times on social media where somebody says, 3 times a week forever. That's not the truth. That's just not the truth. There is some validity to it in the early stages of care.
Yeah.
And the reason why there's a need in the beginning of care where a person needs to come in more frequently is because ligaments that hold those bones together, when you come in and I evaluate you and I find that one vertebra is off position, it's causing pressure on a joint or on a nerve, and it's causing you problems and dysfunction. And let's just suppose I adjust that one vertebra into place, and it takes the pressure off the nerve, allows you to have greater range of motion, you feel better for a moment. But what we're not accounting for is the fact that those ligaments, they act like rubber bands.
Yep.
And so everything's going to shift back again. So when I adjust you and that shifts back out of place again, how long does it take for that to happen? Just a few days. And in fact, that's the reason why if you're an NFL player, you watch these guys out there and they get hurt and they get their knee clipped and they're in PT. They're in PT every few days or so for about 4 to 6 weeks.
Yeah.
Because they have to get that soft tissue to mend properly in the process of healing everything around it.
Yeah.
So there is that early stage that's like that. But as we see that the body's starting to cooperate better, not just that you're getting out of pain, but we're losing that as a piece of the puzzle.
Yeah.
In the end, they're going to be coming in less frequently. And as you come in less frequently, we're going to get to a point where we're going to say, okay, this active care process is now complete. And then you have a choice, and the choice is whether or not you want to maintain your spine. I mean, heck, we maintain our teeth, right?
Yeah.
If you go and you exercise, do you exercise once? No.
Nope.
Maybe 3 times? No. The idea is you do this as part of a routine to maintain health.
Yeah.
If we're not chasing disease, sure, if you chase disease, wait till the next time you have pain.
Yeah.
Sure. Wait until the next test comes along and says you have a problem. But if you want to maintain health, we need to do the things necessary.
Yeah.
And sometimes that does require maintenance, but that is a choice that an individual will take. And what I'll say about the reason why somebody might do this is because they are enjoying it. The same way that they enjoy your services, they enjoy working out. They're not going to say, well, I got that muscle build that I want, and I'm done now.
Yeah.
That's not going to happen.
Yeah.
They're going to say, what else can I do to do this better and,
Yeah.
and improve my strength and flexibility and everything else?
Yeah.
So it just kind of works into the whole equation of wellness care.
Yeah, I think that's perfect right there, because like you said, and very similar to how I deal with our members and our program, there is a certain point in the beginning where you're going to need to come in and understand and go through the motions and understand movement patterns and build a little bit of strength and efficiency first, and then you're going to start to really see the changes come along. And we don't necessarily take the foot off the gas pedal, but you don't have to do as much, and it doesn't feel like it is much of a burden on you once you get out past that first initial phase. But if you don't use it, you lose it type deal. So if you aren't being consistent with it in some capacity, it can just go right back to where it started.
Exactly right.
Obviously, working with athletes in any capacity with wellness or health is really important.
Yes.
How does chiropractic care fit in for athletes, and do you work with like sport-specific injuries?
We do work with sports-specific type injuries, yes. I would say that the majority of the people that come into our care are not athletes, but we do take care of a lot of athletes because athletes live in our world.
Yeah.
So I am taking care of the weekend warrior. I'm taking care of the high school football player. I'm taking care of the college track player. You know, track. And everything else in between. So I've had opportunities throughout my years. So the kind of things that we take care of are those things that limit the athlete in being able to get their body back on track again. Everything from a hip injury to a shoulder injury to something related to their spine or the combination thereof. Because when you do something like as an athlete, say you're a softball pitcher, which I took care of one who's in high school over here in Phoenixville. And if you're doing that, you're not just working the shoulder, you're working everything. If you're doing this, you're rotating, okay? And so it's everything. It's the shoulder, it's the hips, it's the mid-back. So you have to think about it in terms of the overall dynamic of that athlete and how they move. So, and we have tools here that we can help, in addition to the adjustment. The athletes really benefit by having electric stim or ultrasound or specific exercises that we can employ to help them to strengthen and stabilize the areas.
That's awesome. I mean, that's a lot of information. It sounds like you can take care of really anybody when it comes down to figuring out what the issue is and how you can go about attacking that issue. Do you offer any kind of like initial consultation with somebody that might be on the fence if this is something for them?
Absolutely.
Okay.
Yeah, I will definitely get on the phone with them for 5-10 minutes just to hash it out a little bit.
Yeah.
Let them know, hey, it sounds like something that we can help, or it sounds like something that's out of what we normally do, and let me recommend what you might do instead. Yeah.
Do you have anything else to add about your practice or any of the therapies that you offer that you'd like to add?
You're not going to be sitting in my office long. You're going to get in, you're going to get the care you need, and you're going to get on with your life. And the important thing about that is that what I'm doing here is to make sure that you can get out there and continue living your life, and then use us for for that periodic time frame that fits your budget, fits your needs, fits your lifestyle. So as you can see, I'm pretty real about how I approach things. Hopefully you got that from my personality, but in the end, it really is about just taking care of you, because it's your life, it's your health, it's what matters.
Yeah. This has been a great talk. Dr. Jeff Snyder from Snyder Family Chiropractic. That was awesome. Appreciate it.
Thanks, Joe.